begin. Okay, so I think let's begin. It is our great pleasure as Zijl to host today's webinar called the Psychosocial Care of Children in both the in-hospital and outpatient setting. As healthcare practitioners, we often tend to focus on more of the physical well-being of the children that we care for. And today we want to look at the child more holistically and include the emotional and psychosocial care of these children. And our first speaker is Dr. Karen van Zijl, and following Karen is going to be Mrs. Linda Goldberg. And so if I can just then introduce Karen. Karen is a certified child life practitioner. She's also a play therapist as well as a lecturer at the University of Pretoria. Karen is passionate about the psychosocial well-being of children in all aspects of the South African healthcare system, and is the president of. She's also a certified ACLP member, which is the Association of Child Life Practitioners. And we are so thrilled to have you today, Karen, to come and chat to us about the psychosocial care of children in all aspects of the healthcare setting, as well as looking at the use of play and how we can integrate that into looking after our children, both emotionally and psychologically. So if I may hand over to you, Karen, and I just want to say to end of the session, but please post your questions that you have in the chat group, and then we will pose those questions to Karen and Linda at the end of the session.
Thank you so much, Jackie, and thank you for this wonderful opportunity to share with all of you. Beforehand, I just want to apologize. I have terrible hay fever, so I in advance apologize for sneezing and coughing in between. So let's start. I'm just going to stop my video and let's start with a presentation. I just want to make sure, can everybody see?
It's coming. Yes, there it is. Thanks, Karen.
Thank you so much. Okay, thank you. As I said, thank you so much for the opportunity to share with you all regarding psychosocial care of children, both in hospital and in the outpatient setting. Sorry, I'm just battling. There we go. As we all know, healthcare conditions, hospitalization, and healthcare experiences can be very distressing and traumatizing for children. And research shows that hospital admissions and medical interventions has the potential of causing considerable psychological trauma for both the child and the family interfacing with the healthcare system. And during healthcare interventions, children are subjected to an environment that they don't understand. They have no control over it. Their usual routine is disrupted. They undergo frightening and painful procedures, and all of these are tremendously distressing and disruptive to the child. And according to the Child Friendly Healthcare Initiative, healthcare facilities should promote not only the physical well-being of children, but also the psychological and emotional well-being of the child. And if we look at the ethical framework that is set out by us by UNICEF's Child Friendly Healthcare Initiative, by the United Nations Charter Right out for the child, our own constitution in South Africa, and also the Emotional Safety Initiative, we see that the emotional well-being and the provision of psychosocial support for children should be paramount when children interface with healthcare, and that is part and parcel of acting in the best interest of the child, making sure that the holistic well-being of the child is cared for, not only the physical well-being of the child. And unfortunately, that doesn't always happen. So that's where the profession of child life professionals come in. We strive to promote the optimum development of children and adolescents within the healthcare setting, as well as to minimize psychological distress and trauma. And it's done by using developmentally appropriate play as means of communication and a primary tool in addressing to meet the needs of both the child and the family's psychosocial needs. So play is the main key in dealing with this. So there are various organizations where the Association of Child Life Professionals, the Canadian Association for Child Life Leaders. In the UK, it's the Association for Health Play Specialists. We have it in Kuwait, Australia, Japan, New Zealand, and in Hong Kong as well. All of these associations primarily focusing on the psychosocial well-being of children and families within the healthcare setting. And as I mentioned, we use play as our primary means of interfacing and communicating with children. And the problem is, in the collective subconscious of society, we see that play is not always viewed very positively. We can see that reflected if we look at dictionary definitions of play. Play is seen as a waste of time. It's seen as frivolous activity, as something you do for enjoyment or recreation rather than something serious. It is you don't engage with something seriously or without skill. When it comes to children and play, we find absolutely opposite is true. Play is the primary means of communication for children. It is their mother tongue, and play is fundamental in children when it comes to learning, to try a new role, attachment and affection and closeness. And it's also a mode of healing for the child, because as they play out difficult situations, emotional healing can take place for the child. Can self-express, and they can play out their experiences and feelings. And as Erickson stated, it's the most dynamic form of self-healing for the child. And Maria Montessori also said, play is the work of children. And I love this quote: "It's like a stranger in a foreign land who suddenly hears his mother tongue. The child reaches out to play as an assurance of friendliness in a bewildering situation." And as we just stated, healthcare setting and perceived as safe by the child. I know we as healthcare professionals, that is our intent, that we want to serve, but is that what the child interprets? That's the important part. And if we look at play, it encompasses all the aspects of child development, their cognitive development, physical, social, emotional, and also that's how they attain skills and a sense of mastery and control. So play provides us with a rare opportunity to understand the child's world, and it also allows for a flow of communication and connection when other forms of communication are difficult or even impossible. So if we look at play, it's actually the best avenue of communicating with the child and creating avenues of connection between the adult and the child, because it's a symbolic language. They learn through play. They make sense of their world through play. They take responsibility for their skills. They gain emotional support. Their self-supportive behavior is promoted. And I think importantly of all, it's a mode of healing for children, and stress is reduced. So you can see how by utilizing play, we're really acting in the best interest of the child and promoting the holistic well-being of the child. And then specifically looking at the benefits of play within the healthcare setting. So it helps the child to communicate, and it's a natural means of expression for the child. It's something familiar and that they find an easy avenue in working with. It familiarizes the abnormal situation that is a healthcare setting. It provides the child with adaptive coping skills and self-regulatory skills that they can implement during medical procedures. It helps them to process the illness. What does the diagnosis mean? What do the medical procedures mean? It helps them to understand the treatment, the whole treatment. It helps us as adults to identify any misconceptions that the child might have with regards to the illness, the treatment, the chronic and severe illnesses, and also then to address those misconceptions by utilizing play, and also to help the child identify and express their emotions in a very adaptive, balance their feelings of helplessness and hopelessness and despondency that we see a lot of times with children in hospital. And it helps to diminish the trauma and enhances their self-esteem. So just to summarize, it really is very effective in normalizing the medical environment. It facilitates the emotional expression, and it also enhances their understanding of medical events, both the illness itself as well as the treatments. To look at a few forms of play that we can utilize both as healthcare practitioners, but also as parents with children. So we're going to look at sensory play, mastery play, biblio play, shadow buddies, puppets, medical play, various applications that you can use, and also photos and videos. So when we engage with children in play, what is our role as adults? So it allows the child. So it's really important when engaging with the child by means of these various forms of play to pay attention. Pay attention to what they say, to what they ask, but also to what they do not ask and what do they not say, and especially to body posture. So the idea behind it is exposing the child to a lot of different sensory type of play and asking the child, is it hot, is it cold, is it coarse, is it smooth, is it hot, is it hard or soft? Do you like the way it feels? What do your eyes say? What do your ears say? And really creating a language in which the child can speak about their body and their senses. And that we can use as a basis when it comes to talking about somatic experiences, but also having that pleasurable experience. And then on the photograph at the right, as you can see, also engaging in play with medical apparatus and feeling it and touching it and exploring it, so that when they play with it, and that's not within a medical context that there's a procedure taking place. It's purely in a play context. And as you can see in this slide, using medical apparatus to make arts and crafts, like you can see the nebulizing mask that we turned into a crab, so that it becomes a neutral object. So that when a child sees, say for instance, a syringe or a nebulizing mask or tubing, it doesn't generate a stress response within the child. It's just a neutral object. And also you can, I'm thinking at a home for children who regularly interface with the healthcare system, using medical apparatus that the child interfaces with, and using it for crafts like painting, or they can eat their custard or their drink their cold drinks, like for instance through a syringe, or play it within the bath, or paint outside with it, just so that that specific object becomes, they can first of all explore it on a sensory level, but second of all that it becomes a neutral object, that the brain goes, oh, okay, I know what this is, and it doesn't generate that fear response and anticipatory response within children. Then looking at mastery play. How can we use various forms of mastery play to facilitate understanding in children for their diagnosis and for the treatment? And I have this play vein that I play with children, because most children undergo venipunctures in hospital or insertions of IV lines. And the whole construct of what is a vein and what's inside it is a very abstract construct for children. And most of them function on a very concrete level and rely very heavily on their senses. That's why we use the senses as a primary gate of communicating with children. And one beautiful example, a boy with a hematological diagnosis that I played with years ago that presented with tremendous aggression during medical procedures. We played with the vein and we looked at all the different blood cells and the jobs that they do. And I explained to him with his illness that his factory doesn't produce all the different cells that he needs. So I said to him, so if the doctors, because the doctors and the nurses want to help your body, so where do they have to look to see what your body needs? And he looked at me in amazement and he said, you mean the doctors and the nurses actually want to help me? He never understood that previously. And then by using this vein and explaining how it works, and because then I said to him, he said to me, oh, then they have to look in my, he said to me, then they have to look in my blood. And I said to him, yes. And do you have a zip like this vein has a zip? Do you have a zip? And he said, no. So I said, how are they going to get the blood? And you could see the light bulb going on. And he realized, oh, they have to make an opening. And I said, aren't they kind? They make a tiny baby opening with a baby straw, and they only take out a little bit of blood. And that was a shift for this child when it came to his complying with medical treatment. Because for the first time, he truly understood what the diagnosis was, what it meant, and why those specific medical procedures for him specifically were needed. So this is a very powerful means of explaining the diagnosis and the treatment to the children. And then making use of biblioplay or stories. And children need more than just words to help them understand the medical challenges and treatments they undergo. So the primary goal with biblioplay is to provide visually accurate and direct information to children and their families regarding the illness, the healthcare setting, and as well as the medical procedures and interventions that are going to take place. So there are a plethora of stories that you can find online for various diagnoses, where there's what's really helpful with these storybooks is it provides a framework chronologically for the child of what is going to happen when. So that is really powerful because it gives them this sense of predictability and control. What's also helpful is that the story is told in the third person. So they find it less threatening to ask questions and to say, oh, this character is, for instance, scared about that, or he doesn't understand this. And the child does not necessarily feel that amount of shame to recognize initially, but this is the way I feel. So it's a very powerful medium to convey information to children and start a dialogue that is non-threatening to the child. And then making use of shadow buddies, which is a form of creative play. So what a shadow buddy is, it's like a calico doll that's blank. You can see in the top left, there's the blank doll. And these are some of the other examples of some of my patients' shadow buddies. And you'll see different levels of developmental functioning, how the child would draw upon their shadow buddy. But that's not the important part. The important part is this is such a powerful means of the child communicating both their emotions as well as their physical symptoms that they are experiencing. Here you can see some photographs of a colleague playing with a child with a shadow buddy. And please note the child, look at the child's gaze. You can see how very intently the child is engaging with this medical play that they're doing with a shadow buddy. You can see he drew on the shadow buddy so that there's that ownership of this is my doll. But can you also see from his body posture, he's completely relaxed. This child is not in a state of distress. He is completely relaxed. He is fully engaged. And this is really such a powerful and very effective means of creating a way of two-way communication between adults and children. Um, and it also helps tremendously with addressing both anxiety, emotions, anxiety and pain in children, because anxiety is very closely associated with the perception of pain. And especially for children, it's difficult to avoid feelings of anxiety, even in medical procedures that we as adults might see as non-threatening or minor. And even seemingly benign examinations might be highly distressing for children. I'm thinking of imaging such as MRI or X-rays, or even just stethoscopes that we think that I'm not hurting you. That doesn't mean that's the way the child is perceiving it. And the emotional context can influence the child's perception and intensity of pain. And then both anxiety and pain are very subjective and personal experiences. And it's influenced by the child's developmental stage, the memory of prior medical procedures, and their experience of pain is recognized as one of the most complex human stressors, which may have consequences for later pain-related behavior, their perception of pain, but also how they interface with healthcare as adults. So it's really important that we get it right when they are children. And the concept of pain and suffering go well beyond that of a simple sensory experience. The emotional component of pain is very important and very strong. And that's where the shadow body is such a powerful medium, because it addresses both. And here is an example of a child recently that I used the shadow body as a means of communication. So you can see there the Play-Doh, that's the sensory play that I engaged with her with. That was her favorite. And we started playing with it and she really enjoyed it. So I asked her, please show me on the shadow body, how do you feel when you play with the sensory toys and specifically the Play-Doh? And there you can see the yellow bubbles on her arms and her legs. And she said it makes her happy, and her happy is a bubbly feeling, and she can feel it in the arms and the legs. And you can also see the hearts, the two hearts, because the green heart was for the sensory play, and the big red heart is because she's really good at gymnastics, and she showed me some of the stuff that she can do, and she felt really happy, and she was in a good space, showing me that on her shadow body. And then I asked her, she was admitted for treatment for migraine. I asked her, what takes your happy away? What makes this yellow bubbly feeling smaller? And I asked her, and she immediately said, my pain. And I said to her, so we turned the shadow body over on the back side. I asked her, please show me what it feels like when the pain comes. And I want you to see how very effectively she could communicate the nature of the pain, the location of, the intensity of it, but also the sequence of how the symptoms presented. So the left eye, you'll see, is a bit larger than the right one. So she said, it starts in my left eye and it really pains, and then it goes into the back of my head. And it spreads to my right eye as well, and it really, really hurts in my head. So you can see the red, how she could show that to me. She says, then it moves to my chest, and my heart starts beating really fast. Do you see the scribbling? And she said, and I feel a tightness in my chest. And then my stomach goes ice cold. Do you see the blue? And she says, then I get these like lightning flashes in my arms and in my legs. So can you see how very effective this was for the child to communicate to me precisely how she felt about her illness, how it steals her joy, but also the location, the nature, and the intensity of her pain. This one also of a little girl who came in through our ER, and she really battled to communicate her symptoms. She was coughing a lot, but she just constantly said her pain was a 10 out of 10, a 10 out of 10. So I also started with her, that's the dolly on the left. With the sensory play, she also liked the Play-Doh. There you can see one of the roses that she made. She liked the other sensory toys, and we really engaged with that. And she said it feels like blue sparkles. That's her representation of the pleasant sensory experience. She drew that on the hands, and she showed in her face she likes it, and her heart shows she loves it. So she could communicate her sense of happiness and calmness when playing with the sensory toys. And also when I asked, do you like this feeling? Yes. Can it be in your body? Yes. Okay, what makes this feeling, this blue happy, because her happy was blue? what makes your happy smaller? And she said, when I get ill. And I said to her, please show me on. And then she could start to identify. She says, it starts in my throat. So you see the green tiny dots in the throat area, where she says it starts with a scratching in my throat. And then it moves down, and then I start to cough, cough, cough. Then it moves to my chest. And then it feels like tiny, it scratches at the beginning, so you see the dots. And then she said, and then it starts like tiny little cuts, and you can see the green lines. And she says, then it feels like a rhino is stepping on my chest. Do you see the rhino paw on her chest? And she says, then I cough and cough and cough. And then that feeling moves to my tummy, and it moves to my head. And can you see how intensely she feels that sensation in her abdomen and her head? And this was a child who could not articulate the nature of the pain, the progression of her symptoms, the intensity thereof, and how very effective this was, using the shadow body to assist her and to almost create a language that was familiar to her to speak about her own body. They're making use of puppets. This is Alfred on the left that I use a lot. He's called Alfred, and he's been to hospital many times. And what's wonderful about about the puppets is you can use that to teach children also about medical procedures, about diagnosis, and it's a very non-threatening way for children to engage with medical procedures, because they then can do it on the puppet. And as you can see on the photograph on the right, if you look at the body posture of those two children, you can see they're completely relaxed and fully engaged and present in play, but not threatened or distressed in any matter. And using these puppets during play, we can really facilitate felt safety within the child. So for instance, we are playing out a blood draw on the puppet. Then we can introduce soothing sensory experiences as a means of adaptive coping skills. So, okay, what toy would this puppet like to play with while you draw his blood, or give him an IV line, or clean his burn wound, and introduce by means of play adaptive coping skills by means of soothing sensory play. We can practice the deep breathing with a puppet. Say, okay, when you feel scared, smell in your best smell and blow your bubbles. We can practice positions of comfort, not restraining, but the child comforting the puppet, in rocking and swinging, and we can see what form of comfort position the child finds most pleasant, and we can use that during a medical procedure with the child himself, making use of proprioception like weighted blankets or the magic mustache to help, and then we practice calming down the puppet during a medical procedure, and then the child can implement those very same techniques when the medical procedure is done on their bodies. And also making use of alternate focus. These can be I Spy games, nice picture books. If you have access to a smartphone or a tablet, having, say for instance, the child loves animals, then you have silly videos of cats or dogs, or even if you have murals in your hospital, playing I Spy games with the murals. So alternate focus is anything that the child finds interesting and stimulating, but in a non-threatening manner. So it can be glitter wands and spinning games and interesting toys that you have present. Bubbles is also a very effective means of alternate focus, blowing bubbles for the child and letting the child blow bubbles. And we practice that during play with the puppets. And then making use of medical play. What's wonderful about this is it once again gives the child the opportunity of a sense of mastery and control within the healthcare setting, where they have such a tremendous loss of control and predictability. So within medical play, they are the doctor or they are the nurse, and they play out whatever is happening to them. And within medical play, you can use both the physical medical apparatus, but you can also use toy versions, especially for children who are highly traumatized and find the real medical apparatus very threatening. We start with so I usually put out both, and I see which one the child gravitates towards. So if they have an aversion initially to the real medical objects, then that's fine. then we just engage with the toy versions to give them that sense of mastery and predictability. And also within medical play, you as adults, you ask lots of questions. You say, okay, what is happening now? And what does this mean? And what rather, using what words rather than why, because why is abstract. What is concrete? And children at this age, in this developmental age group, are more concrete. What made them do this? What is happening now? So then you can identify, are there any misconceptions the child has, and you can address that. So the developmental level and functioning, as well as the level of cognitive functioning of the child, will have an effect on the child's understanding of the medical procedures, and it will thus influence the manner and content of medical play and preparation. So the goal is to enhance understanding and to facilitate coping, and thereby reducing distress. And distress is generated when there is a discrepancy between the expectations of an event and the actual experience. So that's also what we want to do within medical play, that the child has a realistic expectation of what is it going to be like, what are the sequence of events going to be, what do the things look like that the doctor uses. Even if it is the toy version, still it creates that expectancy, oh, someone's going to look in my ears, or someone's going to look in my throat. So here you can see a little girl playing with a toy version of a stethoscope with her shadow buddy. And then also on a sensory level, you explore it. You can ask them, is a stethoscope hard or soft? What does it feel like? Is it hot or cold? Is it squishy? So you also neutralize during medical play those medical apparatus. So it's a neutral object and no longer as threatening. And for instance, here in the left-hand side, you can see those tubes, and we use that a lot so that the child can crawl through them and practice being in an enclosed space before we do a CT scan or an MRI scan. And there's the shadow body in our sort of makeshift MRI where they practice going in and out, so that the child is in control and they have that sense of mastery, but they know what to expect when they come to the MRI machine. And then the top right hand, you can see the two little girls playing with that teddy. The one's giving him the anesthesia and the other one's taking his blood pressure. But you can also see how very intently and focused they are during their play. So as we saw what Maria Montessori said, play is the work of children. And you can see how seriously they're engaging during this medical play. And the little children at the bottom right, how they're engaging with the physical medical apparatus itself, and by playing with that, neutralizing those objects. Then looking at some applications that you can use in playing and interfacing with children to help them to communicate both their pain and their emotions. First is the ICPCN app that helps children to communicate their pain. So on the first screen, the child then can touch, and then the red dot will appear where they have the pain. And pardon me, then you can choose whether you would like the face scale or the number scale to indicate the intensity of your pain. And then helping them to identify the nature of their pain. You know, is it a burning? Is it throbbing? Is it jiggling? And then stating, is there anything that makes it better, their pain? Is it anything that makes it worse? They can write it down. And then, does the pain move around? Does it stay still in one place? Is the pain always there or only sometimes there? And then they can indicate all of these. And even with young children, you can show them and you type in. But what's wonderful, especially as parents, when you use this app, it saves the information for you. And then you can get an indication of what is the pattern, long-term pattern of your child's pain. And this app, it's called Trigger Stop, really helps children to communicate both the emotions and their physical pain. So when it opens up, you'll have those 4 figures at the top. And I usually use the very light figure to say, I feel this very, very lightly. The yellow one means it's quite strong, it's there. The brown figure is it's very strong. I feel it really intensely. And the darkest figure is it's so bad I can't take it anymore. It's really bad. And then I can show you the intensity of either the emotion that they feel or the physical pain or the combination, because usually it's a combination of the two. And then as you move up the dot on the left-hand side, both the faces at the top change and the icons on the right. So they can show you the sensation of where do they feel it in their body. And I also usually tell them, please show me how much. So if they put lots of icons, then it's a really intense feeling. Only a few icons, it's a light feeling. So the boy that did the one on the very left, what he said is with his symptoms, it usually starts with his hands. His hands go cold and clammy. That's why he put the snails there. And he says, next what happens is then my legs go numb. It feels as if dinosaurs are sitting on my legs. Then my heart starts racing really, really fast. It feels like a rocket. And then the pain starts in my head. So can you see how beautifully you could communicate the progression? And as you can see, he feels highly, highly upset about this. Very powerful way of children communicating, and a two-way communication. This is the PicBack app, very similar to the ICP-CN app, the first one, of location of pain and intensity of pain that they can communicate. And then if you don't have access to a smartphone, you can make use of like these pain diaries, print them out, and then physically on paper let the child draw and show you. And they don't have to use these colors necessarily. If they would choose another color to show their pain, say for instance black or gray, then they're welcome to do that. This is just a means of supporting them and helping them to communicate more effectively, both emotion and pain. And then making use of photos and videos. It's really helpful, especially for parents, if you could ask healthcare practitioners beforehand to send you photographs of the actual building that you're going to be in, especially for neurodiverse children on the autism spectrum. Because for them, as we said, if there's a discrepancy between what they anticipate and what actually happens, that generates the stress, and that's our enemy. So here I am in our hall, the hall of our pediatric ward with Alfred. So using these to show children, but both, as I say, the environment that they're going to interface with, but also the sequence of events that's going to take place. So, and we use these to prepare children. So the goal of psychological preparation is to increase the child's sense of predictability and control in potentially overwhelming experiences, and allowing them to proceed with a sense of mastery and the lowest possible level of distress. So what we want to do, as I said, we want to give them control. We want to increase their sense of mastery. We want to lower their distress and anxiety, and promote optimal emotional adjustment, and also help them to cooperate during medical procedures, so that minimal restraint, preferably none, is necessary, and therefore creating less trauma and distress for the child. Here you can see Alfred and I in our theatre with our gastroenterologist. So usually what I do is I'll have a series of photographs explaining the sequence of events that are going to take place. And what's really effective in making use of photographs is, this is our anesthesia machine. And to say to children, because usually they find this machine very frightening and threatening, but to say to them, do you know what this machine means? If you see this machine, it means you are loved, and it means you are cared for, and you are very important. Because all these screens and these little buttons, it's there to make sure that you get enough oxygen, that you are comfortable, that your heart beats properly, that you are well taken care of while we fix your body while you're sleeping. And do you see that balloon there as well? That's the balloon that you're going to blow up. And then I let the child physically blow up the balloon in my playroom or in the ward, so that to help with that reformulation. So the moment when they see that physical object, then they realize, oh yes, that machine means I am loved, I'm well taken care of, and I'm important to these people. They are going to help me. Whereas previously, it might have generated a tremendous amount of distress for the child in not knowing what this humongous machine means or what it's used for. So research proves that children who are prepared for healthcare experiences in a manner that is developmentally appropriate, and that means using play, using photographs, show more positive outcomes in their behavior, in their recovery, as well as their ability to cope with stressful events. And preparation and medical play leads to less emotional distress, better overall coping, not just in a healthcare setting, clearer understanding of medical interventions, and more positive physical recovery. Providing accurate medical information to children lessens the negative behavior and promotes faster recovery post-operatively, while also attenuating fear and anxiety. And another study that I read said that these principles that we teach children when preparing them for medical procedures and the adaptive coping skills, they start to implement that in other contexts where they might feel threatened or overwhelmed. So here you can see a photograph of us in the MRI machine, and it's really helpful if you can then, for instance, also have this recording of the sounds that the MRI machine can make. I once prepared a girl for MRI, and afterwards, when I asked her what was it like, I said, she said, no, Auntie Karen, it's not. I said, but I played you the recording. She said, yes, but you didn't say it's going to be as loud as an airplane. So I said to her, thank you for correcting me. Next time the other children, I'll tell them it's as loud as an airplane. So it's really helpful to be as accurate as possible. And then, as I said in the beginning, even procedures that we might see as non-threatening or benign, such as x-rays, children might find that threatening. So presenting them with the photographs, the sequence of events, how it's going to take place when they're going to receive an MRI is really effective and helpful. So just to sum up of what we've been talking about, our aim with the play is to help meet the specific needs of the child. So for instance, to understand, what is my illness? Why is this medical procedure necessary? Why am I in hospital? To help the children release and express their emotions, especially the negative ones that they find difficult, like frustration or anger or fear. And that might not only be related to the illness itself, but also to the social complexities arising from their constant hospitalization or illness, being far away from home. They're aware of the fact that it generates distress and anxiety within their ecosystem, and helping them to articulate that specifically, and help children to experience a sense of mastery over what they are currently dealing with, as I mentioned, like with medical play. And it creates an avenue for the child that they feel they're heard, they're seen, they're heard, they're understood, and they matter. What they think, what they feel, what they experience really matters, and somebody's listening to them. And connection is facilitated. And I think that is actually paramount, especially for children who are hospitalized for long periods of time, and some of their family members might not be able to be there constantly, to feel a sense of connection with the medical personnel in the ward, so that they know that they are loved and cared for, and this is a safe environment. So thank you so much.
Thank you so much, Karen, for an excellent presentation and for sharing your expertise and insight and giving such fantastic practical examples in the in an outpatient setting. So thank you, Karen. We're going to take questions at the end of the session, because we're going to move on now to our next speaker, who is Mrs. Linda Goldberg, who is a physiotherapist who has her master's in child development. And if that wasn't enough, is now completing her second master in child life and psychosocial care. Linda was also the recipient of a bursary to attend the ACLP, which is the Association of Child Life Practitioners, in Texas this year. And so she's going to be feeding back some of the core features or highlights from that conference, which have to do with the psychosocial care of children. So thank you so much, Linda, if you want to share your screen.
Thank you. And thank you so much for giving me the opportunity to feedback. Let me just do this. Is it coming through?
Yes, we can see it. Thank you,
yes.
Linda.
Okay, so thank you so much for giving me this opportunity. And really, I think for me, working in the hospital environment as a physio, it's always bothered me over the years, looking at the children and how distressing it is for them to be in hospital. And we as healthcare, as therapists and all that, we come in, we do our therapy, we leave, and just not understanding or not it's just bothered me all the time. And, when students come to me and say to me, Linda, I just walk into the ward and the baby starts screaming or the child starts screaming. I can't even get close to them to do my therapy. And so just being exposed to child life professionals and to the whole speciality has been a real aha moment for me in my, working as a therapist. It's just made so much difference in the way I look at patients, the way I look at the children, the way I look at the parents, how they're experiencing the whole hospitalization. So I have to say that it's really been a fundamental shift in my career. So firstly, I'd just like to acknowledge the ACLP for giving me the opportunity to attend the conference. It really was a privilege. There were 6 of us that were scholarship recipients. There was myself, there were 2 psychologists from Pakistan, there were 2 child life specialists from Australia and 1 from England. There were other 2 people that were meant to come. There was 1 person from Ghana and 1 from Georgia, but unfortunately they couldn't make it. The conference was just outside Dallas in a little town called Grapevine, and it was my first time to America. But yeah, so it was an unbelievable experience. And I'm sure for most of you that have attended these conferences, there's just so many talks and so many things that you want to go and listen to, and you kind of then have to pick and choose. And that was really difficult for me to choose which talks to attend to. And also in this feedback, I wanted to try to find the talks or the information or the ideas that I thought were really relevant to me as a physio and working in the South African context, because there was just so much information. I was the only physio at the conference. I don't know if they've ever had a physio attending. People were quite surprised when they asked me, what I did, and I told them I was a physio, and they're like, well, why are you here? And that was, it kind of made me realize as well that maybe perhaps us as therapists have this, people have a perception of us that we don't look at the psychosocial aspect of the children that we're working with. And, we're using the ICF, we use, looking at participation and the positive and the negative aspects and bringing ICF into our treatment. So I think we as therapists, we do look at the psychosocial side, but maybe we, especially in hospital, we're not focusing enough on it. We use play, but it's often to achieve our goals of therapy, to increasing range, whatever we're trying to achieve. So, we are child-led, we do use play, but it's often not, as I said, is for our aims that we've set up. So amongst all the talks that I attended, I just picked out 1 or 2 things that I found, that were really relevant to the South African context. And there was a workshop on cultural bias, worldview, and how we interact with our patients and how our own worldview and our biases and cultures affect patient care. And that was quite an extensive workshop. It was almost a full day. And, as working in South Africa, I think we're all very aware of this. But it seems to be, this is a worldwide phenomenon of just having to deal with our own biases and, that, and just understanding that what we bring into our healthcare environment and our sessions with our children, how deeply it impacts on the patient care to the child and with the parents. The second thing that was very much spoken about a lot during the conference was these adverse child events, and I think, ACEs, and I think we're all aware of it, but it's really becoming a big part of healthcare on how these adverse childhood events are affecting the children and adults, as the children grow older, and the impact on chronic diseases, and how what happens to us or to children at a very young age impacts on the body, on the mind, on future health. And I think if we look at there's 10 of these adverse childhood events, and if we look at them, so many of them, just going through them: physical abuse, sexual abuse, verbal abuse, physical neglect, emotional neglect, There's just so many that unfortunately our kids in South Africa are experiencing on a daily basis, witnessing a mother being abused, losing a parent, divorce, death. There's just alcohol abuse. All of these are just so pertinent to our environment, and I think we need to just be more cognizant of this and how it's impacting on the children that we are treating, and how it may be affecting their psychosocial status at the time that we're working with them, and taking that into account. Another big area of discussion on the conference, and it's something that I think I certainly haven't been exposed to a lot within the South African context. Other people on the webinar may have, had more exposure, but I think it's something that we need to start looking at and understanding, and that's the ethics of providing care for patients who identify as gender diverse and uncertain environments. So there were 2 talks on this. I couldn't attend both of them, but the one I did attend, it was focused a lot on the legislation in America, because at the moment what's happening is there's a big shift between the majority of the states actually banning gender affirmation healthcare intervention in children under the age of 18, whereas a lot of them, it was allowed before. So children were starting with all this gender affirmation care, whether it was puberty blockers or hormone therapy. And what's happening in a lot of the states is now that and a lot of these kids would get these patches inserted for hormone therapy, but now it's become illegal. In fact, it's in a lot of the cases, a lot of the states, the parents, if they allow their children to start this kind of therapy, it's considered child abuse, and they can actually be imprisoned. So now what's happening, they brought an example in the one state, I think it was Indiana, where you've got this hundreds of kids that have these implants, and now they all have to go back to hospital and have these implants removed, because they're no longer allowed to continue with this treatment. So first they had all the effects of, the psychosocial effects of starting the therapy, and now stopping the therapy. And it's there's a few cities in America, they call them safe cities, where it is still legal, and it's creating a whole movement of families, disrupting families, because if they want their children to continue with this treatment, they're moving, it's separating families, half are getting left, one side. So it's created a whole lot of psychosocial elements, and how to provide healthcare for these kids that are busy transitioning or have transitioned or want to, so it's a huge element. And it was just fascinating sitting in the audience, because it created so much discussion. And there were a few, the audience was kind of divided, and there were some parents in the audience that had kids that were going through this process. There were some that were vehemently opposed to it. So it was very interesting to see. And I think in South Africa, I don't think we're really looking at this, and I don't think we're really understanding, just looking at our healthcare environment at the hospitals, where, there's big wards, lots of children. How do we place children in the wards? Do we have mixed sexes in the ward? There's no privacy between the children? So this was a huge eye-opener for me topic. And I think it's definitely something that going forward should be looked at in our healthcare environments, more clearly as what is really going on. And then the other really important, it's a personal interest for me, is as I'm working in a NICU, I really get to see the challenges that parents have working, having a baby in NICU. And there's a move there to look at the psychosocial care of what's in maternal fetal medicine. So they're looking at moms with high-risk pregnancies that are really battling with complications. And the reality is that they probably will be having a premature baby. And just working with them before and getting the parents and the moms used to being in the NICU environment, and explaining to them. And really getting them to understand so that when they do get there, because it's generally an unexpected event, that it's not an overwhelming experience. So this for me was really, really interesting, because I don't think we look at that. And as I say, I could be mistaken. And if anyone does do this, I'd love to hear from them. But it was really just looking at those high risk parents and preparing them, and that psychosocial element of having a premature baby, and how they could, what's going to play out for their future, in the near future, in the NICU. So that, and the other on the same topic that they're looking at is we're seeing that here. I see it a lot in the NICU where I work at, is the NAS, the neonatal abstinence syndrome. It's the babies that are born from moms that are, here some whether it's recreational drugs that they're having withdrawals from, or often we're seeing from just the anti-anxiety medication that the moms are taking during pregnancy, and just working with the psychosocial care of these moms with babies that are having these withdrawals, and dealing with their anxiety over it, and just dealing and showing them how they can deal with the children, with their babies. So that was also really, really interesting for me. And lastly, there was one talk I had to go to. It was about, that's gross, improving medical compliance. So I don't know how many of you have ever tasted medicine that our poor kids are forced to take, whether they're in hospital or even at home. And I know with my kids, I used to have a rule that I wouldn't give them any medicine until I tasted it, just so that I got, had an idea. So in this session, it was great. They each gave us a whole pack. There were about 10 medications in little syringes, and we had to taste each one, and each one was worse than the next one. And these are typical medications that children are forced to take in hospital, out of hospital, and we kind of stand there and just say, you will take your medicine. And when they spit it out at us, we get really cross and start shouting, and parents start shouting. So it was really just to understand how disgusting this medication was. And understanding, and also they explained to us like how to make it easier for children to take medicine, different ways to swallowing pills. And it was just, that was really, I mean, by the end of it, all those medications, we all felt rather terrible. But that for me was also a real big eye-opener, and just to experience what it's like to have to take medication that's not pleasant. So I think overall the conference was really, it was fascinating. Everyone was so welcoming. As usual, you say you're from South Africa, everyone wants to ask about our healthcare system, how we work, our caseload. That for them was fascinating, how many patients we get to see on a daily basis, because that was also a very big topic for them, is burnout. In the child life profession, they, a lot of people leaving the profession because of burnout, because of challenges like that. So, they were very much about, what's my self-care. There were a lot of lectures and talks about self-care and resilience in working in the healthcare environment. So there was just so much to learn and experience. So I definitely recommend, if anyone is interested, they do give scholarships every year. It's too late for next year. They've already closed, but if you look on the ACLP website, they've got all the information. But yeah, it was really, it was fantastic. I'm happy to answer any questions that anyone might have, but I think I'll end there.
Thank you so much, Linda, for highlighting such vital topics from that conference. That sounded absolutely fascinating. I do see that we are over time, but we have a few questions that have popped up in the chat group. So if people don't mind us just going a little bit over the time, then we can answer these questions. So the first question was from Elizabeth Ho, who asked the question that, I'm just trying to find it, and Karen, I think this would be directed to you, that kids scream the most when they're in the orthopedic clinic when having their POPs removed. So what type of advice would you provide in that setting?
Thanks. I would first of all give lots of sensory information before you engage with the machine. Like give a photograph, say this is what the machine looks like. These are the types of sounds that it makes. If you can have like any form of play, like if you can put it on a doll, or if you can use Play-Doh, anything, think on a real sensory level, any senses that the child is going to engage with, especially with this machine. Because usually what does the screaming mean? It means there's a stress response that was generated. So what we want to do is we want to prevent that stress response by neutralizing the sensory information that they get, so that the senses go, oh, I know what this is. I know what's going to happen. So maybe have a look, stand in the corner when the machine comes in and notice, is there a distinctive smell? What does the sound look like? What is, or sound like, what is it? And give all of this beforehand to the child, so that they have a sense of both a sequence of events that's going to take place, as well as all of the senses that are going to be engaged during this procedure. I hope does that answer your question? Elizabeth, can you give me a thumbs up if that is helpful? That's a pleasure. And the other one was about the breathing.
Second question.
Pleasure.
Yes.
Was about the breathing techniques. Yes, I start like really low, even with some infants, because they observe your body posture and they observe what you do. And then just mimicking that behavior, and the child follows suit. And you ask specifically, do I actively teach the parents? Oh yes, of course, because children tend to co-regulate with their parents. So if you have a calmer parent, you'll definitely have a calmer child. And so especially in preparing for medical procedures, I love having the parents present and answering their questions, but especially when it comes to adaptive coping skills, teaching it to the parent and to the child. And you usually need a plethora of those. So if the one on that specific day doesn't work, you can fall back on the others that you practice. But in answer to your question, yes, even with infants, teaching the parent to do, the breathing, the in and the out, because then as they hold the baby, they follow suit. And then with toddlers and so forth, as I said, pretending, what I usually say is, what's your favorite smell? And they'll say, let's say spaghetti bolognese. So I say, pretend holding it in your hand. So smell your spaghetti bolognese, or smell your apple. So be very, very specific. And then blow your bubbles. And if you can have bubbles present, but if not, then pretend blowing bubbles. So that long, slow exhale movement.
Well, thank you very much.
Pleasure, Heather.
Thank you, Karen. Thank you. I don't see any other questions, and unless anyone has anything, they can just pop their hand up.
This one's for Linda.
Yeah. Just reading the whole question.
Yeah, sorry, it's quite a long. Tracy,
yeah.
Tracy, if you want to just, okay, have you finished reading, Linda?
Yeah, I mean, so Tracy, it really was, fascinating, and I think that is something that we really should look at here, introducing and more preparation for NICU. I must say, it was one of the talks that actually there were the fewest of us there. It was quite frustrating because, it's such an important talk, and it doesn't seem to be like there weren't that many, people there. But for me, it was just so relevant, because that's where my research is at the moment, that I'm looking at the parental experience in NICU. And most of the parents all the parents were that they were having complications during their pregnancy, but then had no preparation for NICU. Like there just wasn't, no one ever mentioned anything to them, no one explained what, and that came up very strongly. So I think it is something we need to look at and try to see if we can introduce more.
Thanks, Linda. I don't see any other hands or questions. So I just want to say a massive thank you from SA Child to both Karen and Linda for highlighting such important components of looking after our children holistically in the medical field. And not just about normalizing the medical side through play, which Karen has so beautifully demonstrated with her talk, but also about teaching children coping skills so that they can make sense of their environment and they can actually be able to deal with the situation that they are placed in. So I thank you both so much for a fantastic session today. I also want to thank the audience for joining us today. And just to say that our next webinar is going to be on the 25th of October. We're going to be looking at schooling issues for children with special needs. And for those of you that aren't yet members of SA Child, please do consider joining SA Child as members. You have access to our webinars and you can get CPD points. And it also gives you access to the bigger organization that we belong to, which is the International Alliance Association of Childhood Disabilities. And there are also plenty of seminars to join, information that you can access on the internet, which is our knowledge hub. And they also have community of practice sessions where there are live, almost mentor sessions where you can join and discuss issues that you might be having within your own practice, looking after children with special needs. So please do join us as part of the Southern African Academy of Childhood Disabilities. Thank you everyone for joining today. And thank you again to our fantastic speakers. Have a great evening.